This next slide looks at the number of new cases since February the 7th, and what it's looking at is looking at it broken down by age category. So you can see that back in February, through the month of February and into even the first part of March, our largest percentage of new cases was individuals who were 15 to 24 years of age. That leveled off and declined quite a bit through March and April, but now in the last week, there's a drastic uptick, higher than it's been before in 2 months, of the number of individuals 15 to 24 who are new COVID-19 cases. We're allowing walk-ups and same-day appointments at the fairgrounds with the evening hours to allow more access to the vaccine. We have seen a slowdown in the demand for vaccine that started the week of Easter, continued last week, and this week. That's why we're allowing walk-ups now, same-day appointments, and are trying to offer more evening hours starting next week to allow more time for appointments. We've always been open until 6 p.m. on the weekdays that we're open, but next week we will be open until 8 p.m. on Thursday to allow more time for individuals to come after hours. We are concerned about that. We had started to see a slowdown in the vaccine uptake starting the week of Easter. We'd started to see a drastic slowdown in the number of appointments not being filled and the no-show rate. So we are concerned that people that were already hesitant, that have heard this news, may become more hesitant. I would just encourage people to, that this is one person in a million. They got these rare blood clots, and we're out of an abundance of caution. We are pausing and letting the CDC and the ACIP study this situation so they can provide further guidance. But we have given out thousands of doses of Johnson & Johnson vaccine. These cases were in Forsyth County or even in North Carolina that I'm aware of. It's something to be cautious because we are seeing our percent positive go up as well. So that means there's more spread of the virus in the community. So I think we still have to, it's a race to get the vaccine out there to as many people as possible to increase that herd immunity. I think we're seeing that already in our older population where their hospitalizations has drastically decreased. So we have to get the vaccine out there, but also following those non-pharmaceutical interventions. And that's a fancy way of saying the 3 W's. Keeping washing the hands, waiting 6 feet apart, and also wearing the mask. And we still have to do that. Even though we're reopened, we still need to do that and be cautious so we can get ahead of this virus. Because our younger adults are more active, more contacts, whether it's high school, college, young adults in their careers, more active, they're going to be around more people. So that's going to cause more spread, which is just could eventually, or just could lead to, more restrictions. So really the best way for us to get back to normal is for as many people to get vaccinated. And I'm really calling on young adults to get the vaccine, not only for the protection, and you may not need it as much because you're young and healthy, but you don't know who you're going to come in contact with. And also it'll help our economy and allow us to fully reopen.